Hey there, listeners. I am Joanne Lee Cornish, your truth bomb dropper in the world of weight loss, body composition, and mastering the art of rocking the body you've always deserved and dreamed of in midlife and beyond. Let's cut through the noise. Society tells us it's downhill from now on. We're told to embrace the middle-aged weight gain, embrace the muscle loss and poor health. If that's your vibe, then cool. But if you're ready to defy the narrative, then I am your gal. This podcast is a no fluff podcast where we break down the essential truths of body composition, toss around some practical tips, and dissect the latest trends. I'm not here to sugarcoat. I'm here to show you what's not just possible, but downright probable for you. If you enjoyed this content, be sure to click the link in the show notes to explore how we can team up and kick mediocrity to the curb. I offer one-on-one coaching, my ever-popular group coaching programs, and my corporate Educate to Elevate program. Okay, let's get on with the podcast. Enjoy. Leaky gut, and should you get tested? Well, the symptoms to watch out for would be chronic diarrhea or chronic constipation, bloating and gas, noticeable food sensitivities, fatigue, skin issues, eczema, rashes, hives, joint pain is a big one, and of course, autoimmune conditions. So what causes leaky gut? So poor diet, especially high in sugar, refined carbs, processed foods, all the additives, irritants, and low fiber. Chronic stress, excessive use of antibiotics and anti-inflammatory over-the-counter medications like NSAIDs, infections, and of course, environmental toxins, the air that we breathe, pesticides, plastics, all that good stuff. So how do you test for leaky gut? There are a few different tests. So the first one is the Lactulose-Mannitol Test. So this is a urine test that measures the absorption of two non-metabolized sugars, lactulose and mannitol. So the procedure is that you would be asked to drink a solution containing these two sugars. And after a few hours, urine is collected and analyzed to see the presence of these sugars. So basically, one of these sugars, if you have a healthy gut, it shouldn't get through and into the blood, or very, very low trace doses of it. And the other one would easily pass through. So they look at the ratio between the two, and if you've got high levels of both, then a leaky gut. The second test is the Zonulin test. So zonulin is a protein that modulates the permeability of those tight junctions in your gut. Elevated levels of zonulin in the blood or stool can indicate leaky gut. So this is very common with gluten because gluten will trigger the release of zonulin, and zonulin makes your gut lining more permeable. So it is either a blood or a stool sample that is taken and they analyze it for zonulin levels. But high levels of zonulin definitely suggests increased intestinal permeability. And like I said, gluten is a major culprit, although not the only culprit of zonulin. There's also the intestinal permeability assessment. So this is where some tests measure the presence of larger undigested food particles, toxins, or bacteria in the bloodstream. So these are particles which normally would be contained within the intestines, but due to the larger spaces, let's just say, and larger junctions that allow for undigested food, toxins and bacteria to enter the bloodstream, then this test would show them. So again, this is a blood test for antibodies. When antibodies are triggered in release to these particles being present in the blood. So the interpretation is the presence of these antibodies may indicate that these particles are passing through the intestinal lining and into the bloodstream. And again, That is the intestinal permeability assessment that measures the presence of larger undigested food particles, toxins, and bacteria, which in a healthy gut should not have an antibody response in the blood. There are also stool tests. Comprehensive stool analysis can provide insights into gut health, including inflammation markers, the presence of pathogens, and analyzing digestive function. This is a super simple stool test, which is collected and analyzed, and the results can show an imbalance between the good and the bacteria of the gut, and can also show inflammation, which can be associated with leaky gut. The food sensitivity testing. So there are different tests, but the ELISA test, ELISA by Cyrex Labs, is the one I recommend for my clients. And it's a comprehensive blood draw where they test for the antibodies against various foods. And in a comprehensive test, as in the ones offered by Cyrex Labs, they can test for 30, 50, 100 or plus different foods and different food combinations. So if you're going to do it, I would do a comprehensive test like the Cyrex test. And I would avoid the home tests, which really can give a lot of false negatives because they only test for maybe 1 or 2 proteins. So definitely go to cyrexlabs.com. You can go to the link on there, go down the page, go to Contact Us, and ask them where there is a local provider in your area. So again, the 5 tests we're talking about, there is the Lactulose-Mannitol Test, which is a urine test testing between 2 sugars. The Zonulin Test, which is a blood or stool sample. The intestinal permeability assessment test, which is a blood test that tests for antibodies. Stool test, which is obviously stool, and the food sensitivity test, in which I would really encourage you to get a full comprehensive test, as in that one offered by Cyrex Labs. Thanks for hanging out with me today. I trust I sparked your interest, provided a nugget or 2 of wisdom, and armed you with something practical for immediate use. If you've got burning questions or specific topics that you'd like me to tackle, check out the show notes for ways to reach out. Until next time, stay curious. If you've enjoyed this content, be sure to click the link in the show notes to explore how we can work together. And please go to www.theshrinkshop.com.